It's a great honor to receive this award for my contributions to the interdisciplinary team care process, which PALTmed has done so much to advance over the years, serving as a mentoring organization to so many, myself included. But in my view, this award is more reflective of what my colleagues and I have been able to accomplish as a team rather than a singular effort on my part. Thus, I'm deeply appreciative of all of my colleagues on the interdisciplinary teams at both Kohler and Carter for the great work that they've done. The title of the award, Clinician of the Year, it's not Physician of the Year. So by being named Clinician of the Year, it's open to all of the members of the clinical team, as we call ourselves. It could be the social worker, nursing representative, a rehab therapist, and it's really reflective of interdisciplinary team care, collaboration, and engagement, which results in improved outcomes, patient safety, and less fragmentation of care. I mean, there was a report by the Institute of Medicine a couple of decades ago which recommended team-based care as the best process to avoid fragmentation of care and improve quality. And it was an article by Elizabeth Gallick in Caring for the Ages. I think it was October of 2021, and the title is Interdisciplinary Care. Together, we can do something wonderful. I think the title is so apropos because it's true. I mean, try to do something as a single member of the care team, and if you don't do it in concert with everyone else, it can often go awry, and communications and everything are key elements of the process. So I think that's what makes this award so appropriate. I'm an interesting case in the fact that I serve as a clinical ethics consultant in post-acute long-term care, and there are actually very few of us who do this. What I started doing was working with the team. Before, when I would get the consult, I would speak to the attending physician, I would visit the unit, talk to the head nurse, often a social worker, and visit the patient before we had the interdisciplinary team meeting. So what I ended up doing was calling this the Interdisciplinary Ethics Panel, or IEP as we call it. And then after you do all the legwork, and I would talk to family members in advance if I could reach them, even the CNAs who have invaluable information because they know these residents best, so you can get a better picture of the clinical status, mental status, fluctuations in their function and mental status. And then when we address the problem, we have the key members of the panel, which include the attending physician, usually the head nurse, a social worker, often the dietitian, and other key members that are relevant to the case. It could be the psychiatrist, could be, if it's a swallowing issue, we could have the speech therapist, and sometimes we'll have nursing supervisors. And the reason cases often get referred to me is because there are problems that the team has been unable to solve, and these problems, create moral distress, but they don't list as the reason for the consultation moral distress, but that's often the case. So when we have everyone together, they're all stakeholders and they can express their viewpoint, and we try to come up with collaborative but discussion, hearing the pros and cons, and more often than not, I mean, it doesn't always work, but it works because we come up with a practical solution. Hopefully other clinical team members will have their crack at this award as well. So I thank the foundation.